I'm Dr. Pavlina Suchanova, and I'm here to talk to you today about what to do if you can't breathe from your nose. If you are, as one of the millions of people in America who can't breathe well from your nose, then I would like for you to listen how I can make your breathing better and identify the root causes of you not being able to breathe well. This is one of the most common reasons why patients come to see me. I'm a general ENT, but I specialize in making patients breathe better. There are many reasons why you're able to breathe from the nose. The most important thing is to do a thorough evaluation and then figure out what reasons apply to you. I think one of the most common misconceptions is that patients can breathe from one particular reason. And even though that might be true in few patients, I think my experience shows me that most patients cannot breathe well from the nose from at least 3, sometimes 4, 5, 6 different reasons. And it's a role of a good ENT to identify all the reasons and try to fix them all. And this is how you're going to achieve what you want, which is better breathing, better sleep, and I think better quality of life overall. So how do we figure out what your issue is? First of all, you need to make an appointment and come to see me. During the initial visit, we will do a little procedure which is called nasal endoscopy. No need to be scared of it. This is a very quick visit that takes maybe 2 or 3 minutes. I use a little camera with very thin, basically, end that's very flexible, and we will together look in your nose and identify the causes of your obstruction. I have basically a screen that you'll be watching with me, and so I think this is really nice. Maybe some doctors don't do it this way, but I think I love to show this to patients so that both me and you can see what the issue is. So what will I look at with you? First of all, when I have you come to see me, I'm going to have you breathe just by looking at you. The nose in some patients will collapse when they breathe right here. And this is an area which is called nasal valve. This area is the narrowest portion of the nose, and I think in the past it was a very neglected area by us ENTs. One of the reasons was we didn't have really good means to address that besides really big procedures. And so it's a really exciting time for us ENTs nowadays because we have multiple ways of how to address this area. So if you have a collapse in this area, you have what's called internal nasal valve collapse, and there are several ways of how to address that. Once I examine your nose in this way, we're going to proceed with the nasal endoscopy. So again, you are looking at the screen, no need to be scared. I have a little flexible camera, so most patients think it's going to be very painful, but most of the time it tickles and some patients sneeze. And so what I'm going to be looking at, 2 big things that we look at for nasal obstruction in the nose is 1, the septum. What is that? It's a big wall basically that separates the left and right nose. And in some patients, it can be very crooked. Sometimes we are born this way, and sometimes it's a result of a childhood injury. You might not even remember those. Many times patients, tell me, I have no idea how this happened. But we will be able to identify whether the septum is straight or whether it's crooked sometimes in many spots. This definitely causes severe problems with breathing. One side is usually more affected than other. Also, this can also cause a lot of headaches. When patients have severely broken septum and the septum on one side is touching the other sensitive structures of the nose, it's known to cause what we call rhinogenic headaches. It's a headache that's because of a nasal issue, basically where 2 things are touching that they are not. So once we establish whether you have a deviated septum or not, we will also look at the third structure in the nose, and that's the inferior turbinate. What is inferior turbinate? It's basically 2 sausages that are hanging on the bottom of the nose. We have several of them, but they are not as important for breathing as the lowest one, which we call inferior turbinate. These can be really swollen in some patients. And why? Most of the time it's from inflammation, and this can be due to both allergic and non-allergic causes. Again, once we identify whether you have the collapse or obstruction of the nasal valve, we look at the septum, we look at the inferior turbinates. I'll then go deeper in the nose. And a lot of patients have a lot of nasal obstruction because they have thick mucus. And I think this is sometimes really neglected too, because even thick mucus occupies space. And so again, why thick mucus? If it's a clear to white mucus, this may be mucus from allergies. Sometimes it's really green, yellow mucus or scabs, and this would indicate more a bacterial infection or colonization of the nose. Once we see that, sometimes I also see polyps in the nose. What are polyps? Polyps are basically skin that's really inflamed, skin lining the nose that keeps on growing uncontrollably. This sometimes causes one of the most severe nasal obstruction cases where basically the whole face is obstructed with these growths. They are benign, but they cause very bad nasal obstruction and also trouble with a sense of smell. So again, these things are right next to each other, so the endoscopy only takes several minutes. Once we identify these 2 causes, we'll sit down together and we'll talk. Do you have 2 things? Do you have 3 things? What I think is the most important one causing the congestion, if there are very big polyps or deviated septum that's very significant, or if the patient has chronic sinus issues. I will probably next continue with getting an imaging, which is called CT scan of the sinuses and the nose. This is a painless imaging study. It's a mini scan that we do right in my office. It takes about 2 or 3 minutes. The reason why is when the bone is really broken, there can be other things broken as well, and that can lead to sinus obstruction also. So all these things we'll be able to identify as some further causes of your chronic breathing issues. What we'll do next, we will obviously do treatment plan. For some patients, this is medical management. I never ever would go straight to surgery for any patients because not only because it wouldn't be good medical practice, but because a lot of patients improve with better medical management. What I mean by that is a lot of patients come to me and they say, Doc, I've tried all the different sprays. They may have tried Flonase over the counter, Nasal over the counter, saline as well, and they didn't get any improvement. Well, me as a good ENT, I know better medical management that may really reach deeper in the sinus cavities, such as there's a special allergy spray that uses very different delivery system and it pushes the allergy medication all the way in the sinuses. This is not available over the counter, and sometimes your primary care doctor will also not know that this exists. Again, if the major problem is inflammation and swelling and thick mucus, I will always start my patients on medical management that targets these areas, and usually it's treatment that they haven't tried before. I usually treat my patients for about 4 weeks with what I call maximum medical therapy. If there is a lot of scabs and I think it's an infection, we will culture you, or I will culture you. We will try special antibiotics based on the bacteria that you grow. We will try anti-inflammatory washes. We will try prescription strength allergy sprays that have better delivery systems. And then I re-examine your nose again in about a month. And when I give all the better medical management, in about a month, I always tell my patients, look, you're going to look your best any medicine has basically to make you in about a month. And then that's the time to decide what to do next. I would say about 40-50% of the patients will come to me in a month and they actually report significant improvement because maybe I cured their chronic infection that nobody cultured, that they didn't even know that they had, because the scabs are sometimes so thick that nothing comes out for the patient. And if you live like this for a very long time, you think it's normal. It's really not until we discover what's in your nose and I treat it that you might say, wow, I actually feel much better, even just with fixing chronic scabs, chronic infection, chronic inflammation. The other 50% of the patients will maybe be slightly better, but not completely. And those are usually patients that will have really significant mechanical obstruction that we probably have got the CT scan for, and we're going to discuss the results of the CT scan at this visit. If the septum is very deviated on the CT scan, I may talk to you about performing endoscopic septoplasty. It's a procedure that I've done more than 3,000 times. It's one of my favorite procedures to do in the OR, and it's a very easy way of how to make you breathe better if your septum is very significantly deviated. We will make a separate video about this as well. If a patient has significant polyps and sinus issues, they may be a role for polyp removal and possibly sinus surgery as well to alleviate your chronic sinus issues. Again, these things will show up on the CT scan that we will review at the second visit, and this will give us options on what to do. These days, we don't have only very big surgeries in OR, but this is actually a really exciting time for us ENTs because we have in-office procedures that treat a lot of different causes of nasal obstruction and sometimes also runny nose, thick mucus draining to the throat with post-nasal drip. And so if that's your problem, and we will identify that again on the exam and on the scan, we have several options here. For patients who have problematic mucus that either drips out of the nose or at the back of the throat, causes post-nasal drip, throat clearing, and this can be really bothersome. We have actually a new non-invasive procedure which is called Rhinaer. And this is fantastic procedure that uses heat, basically radio frequency controlled temperature, with maybe 15-20 minute in-office procedure to touch the back of the nose where the nerve is hyperreactive and basically making you drain all the time and causing all your issues. This is fantastic in reducing this mucus, and we can also use it at some other areas like the swollen turbinates that I have discussed before to make you breathe better. One area that's a fairly new area for us ENTs to look at is an area of septoswell bodies. What is that? As we discussed, some patients can have a deviated septum that's a bone and cartilage that's not straight in the middle of the nose. But some patients have a perfectly straight septum, but they have a big swelling at the top of the septum, and it almost looks like an apple basically. And so this can cause significant nasal obstruction for patients. And so we have actually multiple procedures, both Rhinaer and Vivaer, that treat this area with heat. And if you have this problem that's identifiable both on the nasal endoscopy and on the scan, it may be really beneficial to undergo a procedure that treats this area as well.